May marks Nurse Appreciation Week, a special time to celebrate the incredible contributions of nurses. For us, it's an opportunity to specifically honor the third party reproductive nurses we work with every day. This year, we're shining a spotlight on one extraordinary nurse in particular, Lauren Brown, the lead third party coordinator at CCRM Houston. Lauren joined CCRM in 2018 after 5 years of experience as an inpatient nurse. She brings such warmth and passion to her role, where she plays a crucial part in helping families navigate the complex journey of third party reproduction. In this episode, Lauren takes us through a typical day in her life as a third party coordinator, detailing the steps involved in the process, discussing timelines, and offering an exclusive behind the scenes look at the CCRM clinic. Lauren has such a passion for helping others build their family through the help of the amazing science and the generosity of others, and it shows. We are immensely grateful for Lauren and the third party team at CCRM, whose expertise and kindness make a profound difference in the lives of so many. So join us in celebrating Lauren and all the amazing nurses who make such a significant impact in the lives of so many. And please enjoy this episode. Me, you, and who? Who knew it would take more than two people to have a baby? In a world where infertility is no longer a taboo topic, this podcast will take you through all of the different aspects of surrogacy and egg donation through the lens of many who walk this journey in different ways. My name is Whitney Hall, and I am a two-time surrogate, now turned surrogacy coordinator for Egg Donor and Surrogate Solutions, the very agency I used when I chose to carry for two amazing families. With this podcast, it is our goal to help guide and support you as you learn about what it takes to grow a family in an alternative way, as well as hear inspiring and beautiful stories of how this path has changed lives forever. We can't wait for you to hear about just one more way happy families are created every day. Okay, so Lauren Brown, one of my most favorite nurses that I get to work with. Oh my gosh. No, it's so true. It's so true. No, I love working with you. Okay, so tell me just like day in the life. We walk in the morning and we
walking in. We always clock in first because that's important.
Absolutely. Gotta clock in.
We don't work for free. But love to work. So clock in. And then in the morning here we do monitoring. So between 7:30 and 8:15 we might see like 40 patients.
Oh wow.
Yeah, we have them all show up at 7:30. We get people in and out because we understand most everybody has to get to work, got to go drop the kids off, those kinds of things. We try to get people in and out real quick. They'll do their ultrasound, their blood work, and then we'll send them on their way.
Okay.
So you'll see a congregation of like all 10 nurses sitting out there. It was like, we joke, it's like NASCAR. We were like cleaning the rooms real quick, get the next person in, so everybody can keep on going. And then they'll get called for labs inevitably at the time we pull through ultrasound. We're like, they respond in line, don't worry.
Oh, perfect.
So we do that usually until like 8:15, sometimes 8:30 if it's a busy day, but most of the time by like 8, we're done with that. And then it's to my desk. I'm checking emails. We don't get as many emails now. We have our new patient portal, which is great. Mainly because everybody can see the messages. So if I'm out, your message isn't going to go unlooked at because everybody can see them.
Absolutely.
So we'll check the portal, see what kind of messages we have, check the emails, which is all my agency communication coming through, see who's got their legal clearance, who's starting their period, who's got a new match kind of situation.
Yeah.
And then I have to kind of prioritize and see what needs to be done today, what needs to be done later this afternoon, who needs a call right away, that kind of thing.
Sure.
And then also gotta check the voicemails.
Of
Usually
course.
have a bunch of voicemails from, after I left yesterday. And then we go to the chart, see whose labs have come back in, and then just kind of figure out a game plan for what I'm gonna do.
Right.
So some days I'm like, okay, we're just gonna go one thing at a time. Some days I've got 40 million things to do. Let me do what's time sensitive first. How my day goes.
Oh my gosh.
I'm working, the emails are pouring in.
Oh, for sure.
And so it's a lot, and then calling patients. So usually around lunchtime, the doctors start reviewing labs for people who are here today.
Okay.
And people in cycle. A lot of my day is spent checking the fax machine because a ton of our third-party patients do not live here in Houston.
Mm-hmm.
So I'm constantly checking the fax machine, see if their outside monitoring results came in, so then I can go track down the doctor to respond because they're not going to be in the chart. So it's a lot of running around.
You are doing a lot of running around.
And then the phone calls. So then we got to notify everybody who came in. Right. Got to notify if it's a donor, got to tell the donor, got to call the IP with an update. Got to update our agency, let them know.
Thank you so much.
Hey, when are they coming back in? Hey, her retrieval is going to be in 2 days. The GC cycle, same situation. We got to call the GC, got to call the IP agency.
Yeah.
Got to schedule all the things. So we stay busy. Days go by real quick.
I was going to say, you stay absolutely busy. Yeah. So one of the things that I think is so, I always say there's a lot of hurry up and wait. You're definitely mostly just in the hurry. But what would you say to maybe like agencies or intended parents, egg donors, just all entities, surrogates, kind of as they're waiting? What would you say is, I mean, we want them to know like you're actively doing things, but like in the midst of that, just hurry up and wait. If you have a doctor or a nurse that is truly involved, kind of maybe like what are some things that they need to be aware of as you're like during that waiting time?
Real important is to know that there's always something going on. Like you said, like if I'm not getting back to you, it's because I just don't have an update. And a lot of times I don't have time to call and say, hey, I don't have an update yet.
Sure.
So I will get back to you. We try our very best to like respond real quickly. That's one of the things we pride ourselves on. I try to get back to you within the day if possible. If not, I'm going to try to give you a realistic expectation. Yesterday, for example, I got 3 new GC records that need to be reviewed. So I had to say, hey, I didn't get to this today. I'm hoping to have it done by Friday, best case scenario. So at least give you like a realistic time frame, because I understand like everybody's so anxious to get started. Usually it's a big process to get to the decision to even use the donor or gestational carrier. And a lot of times people get, okay, we're ready to go like yesterday.
Yeah.
And I'm like, I'm so sorry. Like I want to make it happen as quick as I can, but we want to make sure like mistakes aren't getting made, things aren't getting missed. So sometimes it takes a while.
Right. We dot our I's, we cross our T's.
There's a lot going on behind the scenes before I can even call you and say, hey, this is what's
going on. Yeah. So tell me a little bit more about like what's that stuff behind the scenes.
So like reviewing records is a big process. Usually I get these packets of records. It's literally sometimes 500 pages that I have to go through. And a lot of times people haven't looked at them before. So you've got to go through and see seropositive syphilis last year that nobody forgot to mention.
Sure.
Things like that. I had that come up last week, actually. There's a whole new can of worms that we've got to address. And so we can't do anything, but we might have to wait a little bit. So it's a lot of reviewing records. It's probably the most time-consuming thing, and a lot of it's waiting for the doctor. Because the doctors, they're reviewing labs, but they're in with patients all day too. Yeah. And so we've got to catch them in between. So I'll be walking down the hall, stalking their doors. Usually when they're finished with an appointment, the door will open. So I'm like, they keep saying, what are you looking for? I'm waiting for the doctor. I'm trying
just
to catch
hang out. Just hold on.
You can send an email, but they might not look at their email. You send their stuff through the chart, especially, but if like outside monitoring, they don't recognize it because it doesn't come through the same way if people come here.
Oh, sure.
So I have to like nudge and say, hey, did you see that I sent you? So that's very time consuming. Yeah. And so a lot of times it's 3:00 and I've been waiting for the doctor all day, and people start calling me asking. I'm like, I'm so sorry, I don't know yet, but I will call you before I leave.
Yeah, for sure.
So that's a lot of behind the scenes. I'm either waiting for the doctor to respond to me or to not be in with somebody so I can talk to them in person, or I'm combing through a PDF of 500 pages trying to find the important stuff.
Well, and I think that's one of the things that I feel like that, I pride our agency in is that we do look at those records prior to try and catch those things like, hey, there was a positive syphilis or, whatever it may be. And then we do that pregnancy history form, which I feel like is like a nice little cheat sheet.
So helpful.
Yeah.
But then we have to go back and verify.
Everybody has to go back.
And that's only because I'm a control freak. And it's like,
but I love
the nursing school and me too. They're like, make sure that you trust what's on that checklist is correct. So I have a checklist for every single patient.
That's fantastic.
With all the required things. I'm a little bit type A, if you hadn't noticed. So I will go through and we initial next to it. So there's certain people, if they've initialed, I'm like, okay, I believe that they actually looked at it. And if not, I'm like, I'm probably going to go back and look at it too, just to make sure.
No, but that's so super helpful. I mean, again, it's that extra, I think that's great for for our shared clients. They know for a fact that we, between all of us have looked through,
And it's not to say things don't still get missed, but try to reduce as much as we can.
Oh, sure. Human error.
We don't want to delay a month because we need to test it got checked off, it wasn't really done, things like that. Yeah. The main thing that's so nerve-wracking is the genetic carrier screening. It takes forever to come back, but we keep running into these panels that don't line up from one lab to another, especially with the donor side. And then we've got to have somebody else retested. But if you do a different panel, something on that one might come back positive, like the donor hasn't been screened for, and then we're starting back at 3 weeks, square one again. So we've run into that a lot lately because all the labs keep closing.
Yeah.
So that's another kind of delay in things.
It's just fun.
I spend a lot of time. I'm not a geneticist, so I can come through, but some of them are listed with just a gene name versus the actual disease name. And then I'm like, I can tell you that it looks like it's right, but you're going to have to talk to confirm.
Right.
And it's just a lot of like run around
Moving
until we
parts.
finally gotten all the clearance stuff done, and then it's a little bit smooth sailing.
Yeah. I mean, you are definitely like that kind of traffic controller. It's like between, because like you said, you're talking to all of these people, agency included, and we're trying to traffic control with you. But I think that's one of the great things that is so wonderful about you and just great nurses in every clinic is that you guys, are looking at that whole picture, but also
organized. If not, it just gets way too confusing. Like I just got back from maternity leave. They're like, "Thank God you're back."
I said it. I said, "Thank God Lauren's back."
It's a lot for one person to do, even two people covering.
Yes.
Like Gwen is in third party, but she takes regular patients primarily, so she's just kind of a helper for the third party stuff.
Yeah.
So Rita was mostly doing it on her own with some help from Gwen while I was out. And she's like, it's just a lot for one person. And I was the only person doing this for probably, I don't know, 3 or 4 years.
Oh,
and we kept saying, we're going to hire somebody else. And I trained multiple people. I had one girl sit down with me for like a week, and she literally looked at me and goes, I don't want your job, Lauren. It's hard. And she left like a week later.
I scared her away. You scared her away. No, what was scary?
I think it's just the amount of things to keep track of.
Yeah.
I think it's not for everybody.
No.
And I kind of got plopped into it. Like I didn't apply for the third party job. The girl who was doing it left, and I happened to be like the newest hire that didn't have like a true assignment. So like, here, Lauren, this is what you're going to do.
Really?
Yeah, I was in the PACU for like 2 months when I first started here. And then the girl who was doing my job before left kind of abruptly. She didn't give like a full 2 weeks even. So I literally sat with her like a day and a half.
Stop.
And the second day was her last day. So she left at like noon.
Oh my
And they're like,
gosh.
here you go. Figure it out.
So did you have any experience with third party infertility, anything like that prior to this?
No. I was a cardiac nurse. And then when I moved to Houston, I worked in the step down ICU for a year and a half. And that really burnt me out. And a girl I worked with, her daughter worked here at the time. She goes, so Lauren, when are you going to leave us? When I was working at the hospital, I was like, well, I've got another 6 months on my contract to get my whole sign-on bonus amount.
Yeah.
But I was so burnt out. I was like, I'll go apply. And so the girl who was working here at the time, she called me. I talked to her for like 2 hours. She kind of explained the whole infertility world in general.
Yeah.
And then I interviewed. They offered me the job, and I took like a significant pay cut and didn't get the rest of my sign-on bonus. But I was so done with hospital world that I came here. So it was definitely a change of pace for sure. Like I started working here. They put me in the PACU for a little bit, and that was such a change of pace. Honestly, it's not for me because it's just way different from hospital world. I was used to running around nonstop for 12 hours. Totally done. And here at the time we weren't doing quite as many cases. Now it's a lot busier. Even just I've been 6 years. Yeah. So back then it was like maybe 3 or 4 egg retrievals in the morning. You might have a couple transfers in the afternoon. In the middle of the day, I was like, Susan, my boss, was like, give me something to do.
Wow.
But then that girl who was doing third party left, and I jumped in, kind of had a crash course of like, hey, this is how we're doing it. Like
sink or swim.
I will tell you the FDA stuff was the hardest part to learn because it's just so convoluted and all the rules and stuff associated with that. That was like the biggest part, learning. And then also figuring out like what you need to talk to the doctor about, what they're okay with you, kind of, the protocols. That was a big change from the hospital too. In the hospital world, you've got to have a doctor tell you exactly what you're going to do every time.
Right.
Here we have a little bit more autonomy because we have protocols in place. We kind of can predict what the doctor's going to do. So you could talk to somebody and say, hey, I think this is what's going to happen when they're asking questions, but I'll confirm after the doctor confirms with me, that kind of thing. So that's been an interesting change as well.
Yeah.
Definitely don't miss the hospital shift life. So every now and then I'm like, I kind of miss the hands-on patient care, starting IVs.
Yeah.
Seeing people all the day, but that was pretty hard.
Yeah, I'm sure. Okay, so speaking of kind of that patient interaction, what would you say is kind of the patient interaction that, I mean, I know you have said you have monitoring in the morning, but what sort of patient interaction do you get to have now? So
I don't do a ton in person anymore. And I started like not saying it's nice to meet you to patients because like we might have already met, but it could have been like 9 months ago when they went through their cycle. Like it's so nice to see you again.
There you go.
But so I don't see a ton in person, but a lot of it's mostly through the telephone.
Yeah.
And then we have our new patient portal I mentioned. It has like a text messaging app. And a lot of people really like that, but some people still like to actually talk to a person. Oh, yeah. So I'm one to like pick up the phone and call if people have like multiple questions in one.
Yeah.
So still getting a little bit of like, at least not FaceTime, but you're talking at least.
Yeah,
instead
for sure.
of just, there's like kind of like, it's not really personal. It's just, I feel like, and sometimes like tone can get lost in a message if there's like an issue that arises. So I'm one to pick up the phone and call if I can.
Yeah.
So that's but mainly through the phone is kind of our main interaction.
Yeah.
But there's a lot of it. So.
Oh gosh, for sure. For
Yeah.
sure. I mean, I definitely like third party is so emotional. And yes, there's the checklists and there's the type A and there's, just we've got to get from point A to point B, but it is so emotional and you do have those tough conversations.
I definitely try to like bring back in the perspective of remembering like most people have gone through a lot in order to come see me. And I tell people that all the time. I'm like, clearly you've either had infertility yourself, maybe you had a hysterectomy and you can't carry your baby, maybe you've got DOR and don't have any eggs and you're 30. Like most people don't want to come see me.
Yeah.
So it's like a big decision to come here. And like when I'm getting the patient has a new patient consult, they say, maybe this is your best option. I always tell them, it's a good idea to talk to you first if you're not sure that's what you want to do, because they can really give good perspective. I always tell them, like Leslie, who's the main counselor that we work with, like she's going to talk to you about, what questions might come up in the future if you decide to go this route. Are you going to talk to your child about how they were conceived, all these things? I say, if you're just getting started, that can kind of put perspective on it, make you feel like you're making a good informed decision if you're not sure yet.
Yeah. Well, and that's amazing that you are taking, the CCRM is taking that time to look at the whole patient and not
definitely.
just.
Well, I mean, we want to start families, but we want happy, create happy families.
That's
right. We want a happy family. Like we want to reduce stress as much as we can. I tell people that. Whatever can make it this easier on you, because it's big strain emotionally, financially, all the things. So we'll do what we can to try to ease the burden a little bit as much as we can. I'm like, if I can at least take a little bit of that stress off you, let me know what I can do to help.
Yeah. Well, you need a good team.
Yeah, definitely.
Yeah. Oh my gosh. Okay. So going back a little bit to, you said, when you got plopped into like this position, and as you were learning, you work with a lot of different doctors who have a lot of, I always say whenever I'm talking to GCs, everybody has just their secret sauce, and they all have their own like way of doing things. How do you juggle all of that?
That's a good question. It takes a lot of brain power.
There you go. Yeah.
Each of our doctors here, all the doctors, they all work generally with the same protocols, which is helpful.
Sure.
But some will say, if a progesterone's low, let's just go straight to progesterone and oil every day. Nobody likes that phone call. So everybody has like their little way that they would respond slightly differently, but for the most part, they have the same kind of protocol. So that's helpful.
Yeah.
So I can kind of predict what they're going to tell me. And then they all have slightly different things, especially like on the gestational carrier side. Like somebody might think the BMI is a little bit more important than somebody else.
Okay.
Get those guidelines. So those are kind of the things that I look at, and it has gotten kind of hard to juggle. So generally what I will do is I'll say, like, these are our strict rules. And then I'm going to send this summary to the doctor and let them just tell me what they want. Like, sure, this looks like a great candidate, or no, maybe not. This is why. And then I get to make all those phone calls. Yes, let's move on to the screening, or no, this is what they're concerned about.
Right.
And then, like with certain situations, like on our GC side versus donor side, with the donor side, it's kind of like no is no. Yeah. It's anonymous.
Absolutely.
We can't break that confidentiality. With the GC side, there's a lot more wiggle room. We can say, hey, this is a situation that's not perfectly ideal, but are you willing to accept the risk and say yes, let's proceed? So there's certain things that are like hard no, and certain things we just have to disclose to everybody.
Sure.
So that they're aware, and then they can decide
if everyone's ready to move forward. Yeah. No. That makes a lot of sense. So, you said there's like a little more wiggle room with with a GC. You're kind of in it, I feel like, kind of for it's much more, I shouldn't say it's not much more emotional, but it's a longer.
Oh yeah.
Yeah. You've got a longer trajectory, I guess.
It's just really like the word disclosure I use all the time. It's really just being really open. Like, this is what the barriers might be, and talking that through. I would hate for somebody to get like this far in the process, say we've done screening, and be like, oh, by the way, this is what's going on. Like, we try to tell everybody up front so that they can make those decisions. Yeah. Again, like the financial side, it's expensive to do a medical screening in general. So we want to make sure they've got all that information so we don't have any like surprises after they've already made that investment to get somebody medically cleared, or they've done legal contracts that they weren't aware of. Right. So try to be as open as possible within the realms of, then you get into HIPAA stuff and third-party disclosures and all that. It's all very complicated stuff. But, I just as open as you can be. No, for sure. It's funny. I feel like I always say social media is kind of that double-edged sword, because you have people that are asking those questions and, trying to getting
medical advice online and going to Dr. Google and Dr. Facebook and like things like that. What have been some of the, maybe barriers that have come up with that? And then, like you said, disclosure. You sometimes see people that are matching, online versus through an agency or, just things like that.
Some of those have been kind of interesting. Like, how legit this is. Like, they'll say, hey, I met this girl on Facebook and she wants to carry for me. And then we get the records. It's totally not a good candidate. And you're like, okay, maybe we need to go a different route.
Yeah.
Like, at our clinic, you can bring your own carrier. You don't have to go through an agency. But we're going to do the same medical work. It doesn't matter where your donor, third party coordinator person is from. We're going to do everything the same on our end, but we still want to make sure pregnancy's already.
Yeah.
The donor hasn't done 7 cycles somewhere else that she just hasn't told us about. That happened last week.
Right.
So things come up. So we want to make sure that all of that is kind of taken care of on like the social media side of things when people bring their own. And just kind of be like, are you fully aware? Especially when they find them online. Maybe push a little bit harder for legal contracts for things. Yeah. Like the GC, it's not questionable, but like for an egg donor, you don't necessarily have to have a legal contract if you bring your own donor, but it's highly, highly recommended. So
I hope you have to have a legal contract. So what do you mean by that?
So when things like sisters go through, we don't necessarily require them to have. So that kind of covers known donors in general. So we really push. Like if somebody is telling me things that sound a little questionable, I might say, for your protection, because a lot of times they don't really know how much is going into it. They just think, hey, I found somebody who's going to give me their eggs, which is great, but we want to make sure that nothing's going to come up.
Right. There's so many things. There's so many. Yes. No, I totally hear what you're saying. And I think that's, again, I think some people kind of think, you said like it's a huge financial commitment to even get that far. And instead you could have gone through an agency who is going to do that legwork and say, hey, that person actually did have a 6th pregnancy that wasn't reported and we were able to find it here, or
and then also like disclosing like the reason why that's a concern is because it could affect the pregnancy and your baby,
right?
Things like that, because we just want to make sure you get to that point, you're already pregnant, and our goal is that you've got a baby. We don't want things to happen with pregnancy loss after you've gone through all of that. It happens, unfortunately. Miscarriages happen with our GCs. It's like an extra amount of heartbreak, I feel like.
Yeah.
Because they've already been through the struggle of needing to use a GC, and now we're
starting
here again. Yeah.
Right. Absolutely. Absolutely. Yeah. So, I mean, those ASRM guidelines are important. They're there for a reason. Yeah. What would you say is, sitting in the seat that you sit in, maybe, that myth that you feel like you see over and over again that you would want to bust?
Oh gosh.
Or maybe a few.
I feel like people think, oh, I found an egg donor, we're good to go from here. But sometimes it's a little more complicated than that.
Yeah.
Usually with a fresh egg donor, you're going to have embryos, but it doesn't happen because pearls are so hard to make when a donor cycle doesn't go well.
Yeah.
Same thing with the gestation. I always try to, again, tell people up front, sometimes you do have to do more than one transfer once you found. Absolutely. Finding the person isn't the end of the game. You got to get all the way to baby. So that's probably the biggest thing that I try to make sure people have a good perspective before they get started. To have like realistic expectations.
Yeah. I mean, it's way more fun to be in happy Lala baby land, but that's why,
that's my goal for everybody.
Absolutely.
If you're a little bit prepared, it could make, if one of those things arise, it can be a little bit easier. It's not going to be easy, but less hurtful, less sorrowful, all those things.
Yeah, absolutely. What would you say, and I feel like I know the answer, but what would you say is maybe the hardest part of your job?
It's juggling between everybody.
Juggling, yeah.
Just because I have a lot of patients, but all of my patients are like times 3 if you count the recipient, the third party member, and the agency.
Sure.
So everybody I talk to has at least 3 phone calls. And sometimes they're like, hey, can you call my husband? I'm like, can you call your husband? But if you really need me to, I will. That's really the hardest part, just juggling. And then like right now I have a bunch of people with all the same name.
Like it's confusing. Doesn't it come in? I feel like it comes in waves. Like we get 5 Laurens, and then we get 5 Jennifers, and then we get
I've got one right now whose first name is the same as the last name of somebody else, and then
no,
all of that. So you really have to I have to be super organized, and I was like, hold on, tell me your birthday, tell me your name, let me pull up your checklist, and then I can talk to you. People get frustrated because I don't actually answer my phone very often, but it's because I want you to leave a voicemail so I can look up your stuff before I call you. So you're not sitting on the phone while I'm waiting for my computer to boot back up or unlock me, and I can actually know what I'm talking to you about.
Yeah.
So,
Oh my gosh. No, that makes total sense. What would you say is your favorite part about what you do?
favorite part is definitely when people come bring me their babies.
Yeah.
And come show me their sweet little squishy babies. That's definitely the best part. Even just like a positive pregnancy test. If we can get to that point, that's always exciting.
That feels good.
But the seeing those babies in mama's arms or daddy's arms is always the best.
Oh, for sure. For sure. Yeah. How have you seen the industry change from when you first started to now?
I haven't been here that long for real, like time-wise, relatively.
Sure,
but just even the 6 years, it's gotten so much busier.
Yeah.
So much busier. I think a lot of it has to do with insurance coverage. A lot more people are having insurance coverage. And even donor coverage. It's not very frequent, but we're seeing more of that. On that front, usually it's frozen eggs, which is a whole other thing.
Yeah.
But a lot of the insurance companies, if they have donor coverage, it's going to be through frozen egg banks. And so that opens up a whole different set of situations because you've got to coordinate with now the lab and an agency and the patient. But the donor stuff's usually already done. So that would probably the biggest thing is just the quantity of patients we're pushing through. I don't remember our numbers for this year, but like last year we have certain parameters we're supposed to meet and we was out of water. Right. Just for the number of cycles that went through. And then I don't even know how many of those were actually our third party patients, but it feels like a lot.
It feels like a lot. Yeah, for sure. With all the juggling that you're doing. Yeah. Yeah. What kind of advice would you maybe want to give to any potential intended parent or woman who's thinking about being a gestational carrier or egg donor as they're kind of discerning this process?
I would say patience is key. And we always talk about this at work. We're like, I want everybody to know that we are on your side. We want you to be successful. If there's a delay, it's because of something outside of our hands. We want you to get pregnant as soon as possible. We want you to have your baby. Like, we're not against you. We're not trying to hold your meds hostage or anything like that. So that's kind of the main thing. We always joke, like, we want everybody, we are on your side. We want you to get pregnant, have your baby as soon as possible, so you can move on to the next stage, which is so fun, raising toddlers and teenagers and all of the things.
All of the things. And then they come into your pantry and unload the whole thing.
Yeah, I've got the whole gamut. 5-month-old, a 4-year-old, and a 15-year-old.
You're across the board.
So
you're across the board.
So we want you to get to all of those stages.
Yeah, you know? It is for sure. For sure. What do you think sets CCRM apart?
They'll tell you the lab. Our lab is top notch. And so that's the most important part. Like, we can be as nice as possible as nursing staff and as communicative as possible. But the main thing is that lab. We need those embryos of good quality. The testing needs to be accurate. So definitely that sets us apart. But I think from a psychosocial, I think our nurses are pretty good. Hopefully most people feel that way.
I'd say so. I love working with you guys.
We try to be nice. We try to be thorough.
Yeah.
We try not to have delays. I don't know about other clinics just because I haven't worked there. We have a lot of patients who come to us from other places and just say, you're really hard to get a hold of. Or, this, that, or the other happened. But hopefully we're doing it better here.
Yeah.
But, there's always going to be people who have issues as well, for lots of different reasons.
Sure.
But we get a lot of those patients that say, hey, we love it here. So
yeah.
We shoot for those, and we want to have everybody have a good experience.
Yeah. For people who are looking to find clinics and and maybe for, people who have come here from other clinics, what are kind of those things that they should look for? Maybe that doesn't feel right.
Yeah. I would say you want to have a good kind of interpersonal relationship with your doctor. It's not the most important thing for you to like them, but you want to have a good feel that they're going to be taking care of you. They're taking you seriously. They understand why you're here. So that's real important, I feel like. And a lot of that you're not going to know until you have it. But then from like a clinical side, from like the nursing side, you just want to make sure I feel like communication. If I was going through, I would want to be able to get a hold of somebody at least within a day. I know I have doctors that I try to call and they never call me back. And then I'm like, well, maybe I'll just wait until next month and try again. But, we really strive to get back to people, make sure like your concerns are addressed, and maybe we'll answer your question before you even ask it.
Yeah, for sure. For sure. Just not being a number in the system.
Exactly. No, and I feel like that's one thing that I do try to do. I say, I've been doing this for a while now. These are the questions that come up a lot. Maybe you haven't thought about it. Maybe this will help you make your decision or make things a little bit smoother on your side.
Yeah. Yeah. Oh my gosh, I love that. Lauren, we love working with you.
Well, thank you.
Oh
it's
my
always
gosh.
a pleasure.
No,
I
love
love those
it.
emails with your pictures in the bottom.
Thanks. We try. We try. Okay, so last question. And this is my fun one. I drained my coffee while I was in the car. But I definitely very much have a codependent relationship on coffee. So I always like to ask, what filled your cup this morning? Literally or figuratively, what was the thing that just got you going today?
Honestly, today it was an Alani Nu Cosmic Stardust. It's my favorite flavor. 200 milligrams of caffeine and like 12 ounces.
Oh my gosh!
Because my baby did not sleep last night.
Oh, bless
I've been up since like 2:15 a.m. this morning.
Oh, you've got a nap coming to you. Oh my gosh.
I did a little bit of sleeping on the chest. You just got to do what you got to do.
You need a little bit of
the caffeine got me this
The
morning.
caffeine is getting you.
And I'm feeling pretty good now. So
you're doing
we'll
great.
see how I feel after lunch. But that's my deal. I don't really drink hot coffee, so the energy drink. I know they're so bad for you, but sometimes
look, you got to do what you got to do.
Uh-huh.
Yeah, when you got that 4-month-old, the toddler, and the teenager, we're gonna get caffeine how we can. Yeah, for sure, for sure.
Today.
Oh my gosh, I love it. At this point in the episode, Lauren took us on an exclusive behind-the-scenes tour of select areas within CCRM Houston. Please note that some parts of the video were edited to ensure patient confidentiality. Enjoy.
So PACU, this is where we come for egg retrievals or transfers. All in-house. The anesthesiologist comes here to our floor in the mornings.
Okay.
So we do our egg retrievals first thing in the morning, usually between 7 and 11-ish, unless we have like a ton.
Mhm.
Usually I think 11 is maybe our record for how many.
Oh, wow.
And then transfers are in the afternoon.
And that allows the embryologist to like thaw the embryo, make sure it looks good before coming in. Yep.
Yeah.
And then magical doors.
Magic doors.
So that's the actual procedure rooms down there.
Oh, wow.
So it's all done just right here in the office. It's kind of convenient that you know where you're coming.
Yeah,
and you don't have to go to like a separate surgical center kind of situation.
Which is so nice.
And then our lab is just on the other side of this wall. So that's where the embryologists live and all your embryos stay there. That's kind of cool too. People always ask where the embryos go. They stay here. And the biopsies go off to the lab.
Oh my gosh, that's awesome. What would you say? I mean, I know everybody kind of, everybody kind of has their own prep, but what do you feel like is super important for people to know?
I think a realistic timeline is helpful, just so you kind of know what to expect.
Yeah.
And then after egg retrieval, we try to let you know because you're gonna not find out how many embryos you have until like a week later.
Yeah.
So being like realistic about how long that's gonna take, and then what do I say? Oh, timeline. So embryos like a week later, 2 weeks after that, we'll know like if you're doing testing, how many embryos we actually have available. So it's good to have like a realistic time frame to understand. Okay, we're starting this now, but it might not be for like another 2 to 3 months before we're actually transferring.
Sure.
Even like for the donor side of things.
Yeah.
Because we want to get those results back before you start the frozen embryo transfer process.
Sure.
So that's important to know. Other things, I think it's important to like talk to your friends. Like more people than you think have done IVF.
Yeah.
And they can give you some good, what's their like morale.
Yeah.
Even if they went through like a different clinic, different protocols.
Yeah.
Sometimes it's a double-edged sword where they're like, oh, well, my doctor did it this way. But I always say, trust your doctor. They're going to give you your best situation.
Trust your nurses.
Yeah. But it's good to have people around that say, hey, I've been through this before. And, I can be here to support you too.
For sure.
About women supporting women.
Oh my gosh. Yes, absolutely. One of the things, so going back to kind of what you said, realistic timeline, I will never forget. I did my first journey here and it was the call after beta and she got on the phone and she goes, so you cheated. I was like, what are you talking about? She was like, well, you took a pregnancy, like a home pregnancy test. I was like, well, yeah, of course I did. I wanted to know.
I know. We always tell people, don't do it because it could be negative and it's really positive. But fully expecting probably most people actually do.
Yeah.
Sometimes people, like call them and be like, I didn't cheat. I don't know. So tell me.
I swear.
Just tell me.
I swear.
Those I try to call first thing. I have like I told you, my checklist. I also have a calendar, so I know everybody who's coming in each day. And I always highlight the pregnancy tests, so I look out for those first because I know people are like probably sitting on pins and needles waiting for that call.
Really to know. Yeah.
I want to know right away.
Yes. Don't you wish? Don't you wish it was instantaneous like that? Yeah, for sure. No, okay, that's super helpful, just especially as far as timeline. Because I think, like you said, it could be negative, but really, actually, it's positive. There's a reason why we want to know that
because we treat anything above a 2 really as positive until we know otherwise. Our record here at our clinic was a 4.
That became viable?
Yeah, live birth. We had the patient stop meds and recheck just to make sure it was negative, and it was positive. So we had her restart meds, and she had a live birth. So
Oh my
it used to be anything less than 5 was treated as negative, but that patient changed our protocol.
Changed your protocol.
Yeah.
Yeah.
So I tell people, don't be too discouraged. We're going to be happy about it until we know otherwise. Yeah. I feel like perspective has a lot to do with, not the science part, but emotionally and stress wise. Just try to keeping a good perspective and
the science can only
positive
take us
outlook,
so far,
yeah.
right? And the
Mhm.
science is so important, but
Yeah.
if
Obviously that's first, but I feel like the psychosocial aspect of things definitely plays a role.
Yeah. Well, and that's one of the great things about having you as that resource, making those phone calls and, being there to kind of have those conversations.
Yeah.
And it's not just, here's a lab report.
Yeah. We want to have the good news, but unfortunately sometimes there is still the bad news too.
Well, sure. But even with the bad news, again, I think that's one of the things that's so great about just nurses in general, but especially y'all, is you guys do take that time to have those conversations.
Yeah, and we're going to say, okay, this is what's going on.
Yeah.
This is what we can do next. And I always tell people, do you want to schedule something now, or do you want to take some time to process? You call me back when you're ready. Because a lot of times they're not ready to think. They just want to go cry, which is totally fine.
Yeah. Yeah, absolutely.
Just let me know when you're ready.
Yeah.
And I'll be here.
Oh, I love
Almost
that.
every day.
Almost every day, except for us. Nothing. We're just saying hi. Yeah, we're just saying hi, but we look like a diva doing it. So we're just saying hi.
Hello.
Okay. This is Gwen.
I'm Gwen. Yay.
Okay, and Reva's over here.
I'm Rita. Hi. Nice to meet y'all.
So whenever you don't hear from Lauren, sometimes you hear from just the whole team. You guys make it happen.
Yeah, we're all in a cubby together.
Oh,
From
happy
one of us.
cubby.
Yeah.
Yes, happy cubby. Yay.
Clean the room.
Oh,
clean
yeah.
the ultrasound machine.
Here's kind of that awesome exam room. Looks like your basic OB situation.
Yeah. I'm excited. We did get new tables last year.
Yeah, there we go.
Comfortable.
But y'all's ultrasound, an IVF ultrasound machine though is
Yeah, these are new. They're
way
pretty,
intense.
Pretty good.
Yeah.
Pretty. These are
Her little
watercolors
embryo
of
art.
eggs and sperm and
Embryo.
embryos.
Yeah.
Just a little watercolor. This is where our ultrasonographers sit here. Oh,
there you
ultrasonographers
go.
sit here. We're podcasting.
We're podcasting.
So their
Hi,
cute
guys.
little ultrasound picture. Nice, fun to point. This is baby Navy, Janice's baby. She lives on the wall. And then over here, their conference room is here. That's where we do all of our meetings. Nothing too exciting there.
Yeah.
We're podcasting. This is Susan. This is the boss lady.
Hi, boss lady.
And then so we just bring